am a senior lecturer at the University of Nairobi School of Law, and I teach gender-related courses and human rights-related courses.
My name is Antonella Akiru, known as Hadas. I am an artist, a social justice artist. I am also a youth advocate. I advocate for girl power.
Lisa Marianne. I'm a youth advocate of sexual and reproductive health rights, as well as meaningful youth and women engagement in political spaces in Kiambu and Nairobi, Kenya.
I advocate for that because I believe that to truly express yourself is to be free. And I also believe that every person has the right to govern their own body.
I believe that just and equitable societies can only be achieved where the rights of all people in the society are actually promoted and guaranteed. And we cannot actually achieve real progress in the society where that is not done, where half of the population are disenfranchised.
So what we need to do is to create more awareness, empower both young people and women, and normalize these conversations not only in our community setup, but also in the decision-making table.
We are now delving into the second part of our conversation, and we're talking about something that's quite important and personal to every woman out there, and actually everyone. And the conversation we're having now is about bodily autonomy. That's a very NGO-y term. So for our panelists, I would like us to just come down and really explain what bodily autonomy is. I'm joined by a powerful group of women, and I'll just introduce them briefly. First is Dr. Agnes Meroka Mutua. She's a senior lecturer at the University of Nairobi School of Law, and she's a passionate advocate for the rights of girls and women. I'm also joined by Hadasa Akiru. I hope I've not massacred your name. She's a social justice artist. And again, last but not least, is Lisa, and again, I hope I'm not going to massacre your name, Marian. She's the founder of Mother and Daughters Foundation. And she's also a psychosocial counselor and a passionate advocate for the meaningful engagement of women and youth. Karibuni sana. So let's just unpack that. What is bodily autonomy for anyone who's hearing that term for the first time, and with your own personal take? We'll start with you, Daktari.
Thank you so much, Akili Dada, for having me here. So bodily autonomy, in simple terms, is that ability for one to make decisions about their own bodies and to be able to actualize those decisions. I would say that in simple terms.
In simple terms.
I would say it is the right to make decision about your physical self. Mm-hmm. Yes.
Thank you.
Thank you. I know the word bodily autonomy sounds so big and to some people vague, but for me, bodily autonomy means self-awareness and identity of one's body, as well as the power to make informed and safe decisions about one's body, life, and future without any form of violence, coercion, or fear.
Yeah, thank you all for that explanation. I know for many people, they might not understand why bodily autonomy has to be a right that is respected, but we live in a world where there are so many norms and traditions that constantly push women down and actually impose on what we can do or what we cannot do with our bodies. So I'll start with you, Hadasa. Why do you think it's important for us, first of all, to elevate bodily autonomy as a right, and why it's important for women and girls specifically?
Because I believe to truly express yourself is to be free. So when you give a girl that freedom, or any young woman out there, they're able to make decisions about themselves and also express themselves in the best way that they could. Yes.
Yeah, and just to stay on that line, why is self-expression really important? I know for young people today, there's that a real push for them to be heard, to be listened to. Why is self-expression such an important thing?
It comes with freedom. Like, you're able to express yourself out there, and it makes you outstand by being different. Yes.
Yeah, thank you for that. And I'll come back to you, Lisa. And you've talked about the importance of, you're passionate about meaningful engagement of young people. And I want to know from your own perspective, and even from the women and girls that you've worked with, why should we elevate bodily autonomy when we are talking of human rights, when we are talking of girls' rights and women's rights?
So from my experience serving both communities and also being privileged in some instances to be at a decision-making table, it's very, very important for women and girls to be aware of their bodily autonomy rights. The main reason being is that most of the injustices that women have suffered or girls have suffered have been with regards to their physical being, just by the aspect of you being discriminated as a woman, and many gender stereotypes, and also our culture. We have so many retrogressive practices that automatically discriminate and deny women the power to make positive choices about their lives. For example, you find in a setup whereby maybe a young girl unfortunately has gotten pregnant when she's still a teen. In the grassroots area, it's common for this young girl to be married off against her will. So that already is one, those are two injustices that have been done to this girl. The first one being defilement, because I believe as being under 18 constitutionally, you don't have the ability to consent to sex, whether it's with a peer or an older person. So that is a case of defilement or sexual gender-based violence, which has led to this young girl being pregnant. And also secondly, her being married off against her will. So you see that when it comes to decision making with regards to women's bodies, their lives, and even their future, they suffer so many injustices. And that's why forums like this that are being spearheaded by Akili Dada, they enable us and to empower women to have their voices, to make them being heard, and also ensure that we are able to achieve gender equality and also address such injustices that really discriminate and undermine women and girls. I think it's also important to note that bodily autonomy it mostly affects women and girls, but also boys and men suffer injustices with regards to their bodies, and mostly you find, especially those who live with disabilities. For example, we've heard of cases whereby some of them are sterilized against their will because there are cultural beliefs that if you're a man who lives with disability, then you should not reproduce because probability is high you're going to produce a child who also lives with disability, which is a complete lie. So I know it mostly affects women, but let us also recognize the fact that it also affects men and boys.
Yeah. Thank you, and thank you for highlighting also just how some of the cultural practices or norms or cultures that we have grown accustomed to, how they can actually deny people's bodily autonomy, right? So I really love that. So I'll come to you, Daktari. Research is such an important piece in advancing just gender equality in general, and specifically bodily autonomy rights. We've had anecdotal evidence of violations against different groups of people, whether it's persons living with disabilities, whether it's girls. So what else can we do, or what are the gaps in research that need to be filled in order for us to be able to move a step further as far as advancing bodily autonomy rights is concerned?
Okay. Thank you for that question. Actually, I think
one of the things I will say from a research perspective and from being in that space at the university is that we need to see the linkages between different rights that women and girls should enjoy and bodily autonomy. I'll give you an example. If we talk about women's economic empowerment, it's impossible for a woman to be economically empowered if actually as a young girl she did not have the right to make decisions concerning her own body, if she was not allowed to actually express certain issues concerning her own body, because those are things that will limit the way in which she's able to access education, the way in which she is able to get into the workspace. We talk about these issues quite a lot. We talk about issues such as menstrual hygiene, for example. Simple things. You will talk to young girls even in high school and they will tell you, I don't know what a yeast infection is. They don't have an idea about what some of these things that affect their sexual and reproductive health are all about. So can we connect the dots? How does the ability to make decisions about one's body affect issues such as economic empowerment, getting into the workspace, breaking that glass ceiling? Because, if for example, I cannot make decisions about the number of children I want to have, how they should be spaced, I will not be on this set today. Mm-hmm. So we need to look, how do these things connect? And I think they connect and they apply. They're all related. So bodily autonomy is related to other rights that women and girls should enjoy. And from a research perspective, we need to begin thinking about this, connecting those dots, not just talking about bodily autonomy in isolation, but really bringing it home and saying, this is how these things are related. You can relate it to economic empowerment. You can relate it to political participation. It's not too long ago that we saw one of our political leaders, female political leaders, going into parliament with a baby. That is an issue of bodily autonomy. Because if I do not have somebody to care for my child, if I cannot make decisions about how my children are going to be cared for, how many children I will have, of course it affects the way in which I go to work, the way in which I represent other women and women's issues. So all these things I think are related, and in terms of research we need to connect the dots and bring it home.
Yeah. Thank you, and thank you for really personalizing it, because I think sometimes when we talk of these terms, it sounds like something that's out there, and people maybe are not able to even draw the connection between me being able to have a carer or being able to decide whether I want to have a carer or not to the question of bodily autonomy. So thank you for really highlighting that, and also for demonstrating the link between education and research. I mean, in the previous section, we talked about the importance of CSE, for example, and having that in school. And I love that we need to have an evidence base in order to implement some of these policies. So Hadassah, I'll come to you. We are talking about bodily autonomy, and we're talking about access to this information. And I love that you're a social justice artist. So maybe you can just share, in your experience, how can we use artistic expressions to ensure that more young people have access to this information, are able to understand what bodily autonomy is, and how do we leverage art to be able to deliver that message?
Art is widely done by young people, especially my age, the youth. So when I use art to express a message in SRHR or bodily autonomy, it is easier for them to access because they listen to a lot of music, poetry, and they can easily relate because I'm young, and the message that on how I'll present the message is how it will reach them. Yeah.
And thank you for that, because I think it's important to speak the language that young people understand.
Yeah.
Because
the way I'll communicate to them is not the same way as you can communicate to them. So because you see, when I do a poem about bodily autonomy and I do it in a Sheng way, they are able to relate easier.
Thank you. And I love that. Like, we can use poetry, we can use songs, we can use different artistic expressions to be able to connect with and also speak to young people. Lisa, I'll come to you. All these things we are talking about here, it's not so easy to access. I mean, even the language that we're using can be quite, can exclude certain people. So in your experience in working with girls and young women, what are the ways we can make sure that information around bodily autonomy, around sexual reproductive health and rights can be made more easily accessible for the people who actually are supposed to be exercising these rights?
So I believe that information is power, and as we all know, there's a famous saying that says, my people die for lack of knowledge. And when you look at such an expression at the community level, you find that most people they live by myths and misconceptions, and they pay a hefty price for that. Actually, the Ministry of Health had released information saying that lack of information is causing them to spend so much money as a ministry so that they are able to actually give, people the proper treatment. That is after they have already messed up. So for me, I believe that information is really important, and governments, CSOs, and even us ourselves as individuals, we can, commit to making sure that the people in the communities we serve have accurate and age-appropriate information. We can do, for example, we can partner with community health volunteers. If you're not in a position to, go to the grassroots yourself, these are people who are already living in these communities. Most of them have been trained and they have accurate information, and they are also, their capacity is built to make proper referrals to health facilities and services. So when you partner with such people, they are able to cascade this information back to the grassroots, because you realize that most people who suffer injustices with regards to SRH or bodily autonomy, they're actually people living in the grassroots communities or the informal settlements. And those who have information, most of them vouch and live by myths and misconceptions. So it is important to demystify such myths and also translate this information in a way that it's relatable, and also it's also cultural friendly. For example, if you go to the grassroots, there are terms that you can't openly use, but you can always, find better ways of giving out this information and expressing yourself in a way that it will be received in a positive light and people will actually take it up and practice it. So I believe we need to make conscious efforts as CSOs, government. We have so many policies that support, sexual and reproductive health rights of women and young people, but unfortunately they are not implemented. So it has to be a collaborative effort, and also what I call collaborative action plan, so that we are able to make sure that everyone has access to accurate information. Yes.
Yeah, thank you for that. And you've basically preempted the question that I had for Daktari about collaboration. Like, what collaborative efforts can we have with government, with educators, with different stakeholders in community to make sure that everyone has access to this information? So over to you, Daktari.
Yes, thank you. And just picking up from what Lisa has said, it's important that we have comprehensive sex education, which you talked about in the schools, and working collaboratively, not just the teachers, but bringing in various stakeholders who are working on sexual and reproductive health matters. So if we are looking at CSOs, if we are looking at Akili Dada, how do we work with schools? One of the things, for example, I have seen happening very well in the context of female genital mutilation is coming up with abridged versions of what the law says. Where can you go for refuge if you are a girl at risk of female genital mutilation? And the schools deliver that information, but they do it collaboratively. The CSOs are helping to develop those kinds of abridged manuals. They are working together with the Ministry of Health and the Ministry of Education. So those are some of the things that we could do. If we look at the health centers, how do we come up with services that are targeted specifically at young people, at young girls? If I walk into a health facility and I am a young girl, I am below the age of 18, I am unaccompanied because I cannot talk easily about these things with my parents. What kind of services do I get? How do I navigate that space? You know, it's not easy to be a 15-year-old, 16-year-old. You need to access a health facility. How do you go about it without, you know, an adult accompanying you? How do we come up? So I think CSOs can also collaborate with the Ministry of Health, for example, and come up with spaces that are friendly, but also that are culturally sensitive, so that if this teenage girl, for example, we find maybe she is expectant, how do we walk her through that journey? How do we get to involve her parents or her guardians? How does the school get involved? So there are a lot of this, there's quite a lot of space for partnerships that we can harness. I think some of it is already happening. If we think about female genital mutilation, as I said, there's quite a lot of collaboration going on. If we think about early and forced marriage, again, there's quite a lot of collaboration going on. The area perhaps we need to strengthen is in accessing health facilities where young people can actually go in and feel that this is a safe space. Like, I can actually talk to a health professional. And let's not take it for granted that all health professionals are able to deliver information in a youth-friendly manner. Training those health professionals, also CSOs can come in and train them. How do you talk to a 15-year-old in crisis? How do you walk her through it, or how do you walk him through it? Those are some of the things that we could do. Of course, also working together with law enforcement.
Yeah, thank you. And thank you for even asking that question. How do you speak to a 15-year-old who is in crisis or who is in need of information? And while we are on that thought, maybe you can, I'd like each of you to share maybe some of the innovative or progressive initiatives that you've seen on the ground in as far as advancing sexual reproductive rights, advancing bodily autonomy. And we can start with you, Hadassah. What have you seen that's working that probably we should invest more time, energy, resources in amplifying?
Maybe setting up trainings where you can talk to those young girls and inform them about their health and educate them about their sexuality. Yeah.
Thank you for that. Lisa?
So one that I've seen work so well is digital advocacy, especially when COVID first hit. Going to the grassroots or doing outreach programs was quite limited during the lockdown period. And since many young people access information on social media, so we can leverage on platforms such as social media and design our messages in a way that young people can easily, you know, receive these messages and have access to them. And then something else is having youth champions at the ground, both at the grassroots level and also the urban level. And you can have youth champions that are not necessarily youth. I know this might, it might sound weird. I know we believe in meaningful youth engagement and nothing for young people without young people, but sometimes you also have to engage the senior group. And by the senior group, I mean those people who are not youth, but are really influential and they are key stakeholders at the community level. Because we realize that some of these topics are taboo topics at the community level. So if you come up with youth champions who are in the senior group, they are able to create safe and friendly environments so that such dialogues can take place at the community level. People can access, information and even get referrals to youth-friendly services and centers, as Dr. Ree has mentioned. Yes.
Yeah. And thank you for highlighting. I think my personal take is that there's room for different actors. There's room for the youth champions, as you call them, and there's also a very critical space for young people themselves to champion amongst their peers for their own rights. So I do agree with you that there's room and there's space for different actors to engage there. And over to you, Dr. Ree. What innovative interventions have you seen in the course of doing your work?
So being in the space of university and academia, it's really a privilege for me to engage with young people like Hadassah here, teaching them on a day-to-day basis. And, they're not short of ideas. So I have seen them, for example, having expressions through art, whether it is fine art, whether it is plays, whether it is, and they express themselves. I have seen young women actually forming groups where they are actually supporting those in high school and really working as mentors, so that there's sort of a staircase. So you have mentors who are in university and campus who are working with those who are in high school, just preparing them. You get into the space of university and it can be overwhelming. There's a lot of freedom. There's a lot that comes with it, yeah? So I have seen young women at the university doing very well in terms of preparing the ones who are coming after them for this space, so that they know, you don't need a sponsor to make it through. You don't need to have sexually transmitted grades, for those who understand what that is. You can actually make your way through it. So that kind of mentorship, for me, it's almost peer-to-peer, because the age gap is not so big. But it's important. And I have also seen expressions through, art which is written. And I've also seen, for example, as I mentioned, abridged versions of the law. So if you're talking about the Anti-FGM Act, it's brought to life in the form of a comic. This is how you go about it. And it's art and it's expression, and it's something that young people can relate to. It is the same law that we read, but when a young person reads it in that form, it makes sense to them. So there's a lot that I think is happening that is quite innovative, in addition to the more traditional methods that we have.
Yeah, I love that. I think I need to have access to that comic, because sometimes the law is written in such a heavy language that it kind of discourages engagement or even reading of it. So I absolutely love that. And I also really want to appreciate you highlighting the role of mentorship, and the fact that young women are taking the lead in mentoring girls or the young women that are coming after them. I think it's such a powerful tool in not only passing knowledge, but also educating people on their rights. So now, as we wrap up the conversation, and we'll start with you, Lisa, maybe just highlight what anchors you as you continue to advocate for gender equality, and specifically advocating for the rights to bodily autonomy. Why is that so important, and what's your call to action to anyone who's listening to our conversation?
Okay. What anchors me mostly is through some of my personal experiences, and also some of the experiences that I have witnessed in serving the community. And I believe that we really need to empower women to be able to speak out for themselves. And in most cases, we find that sometimes, unfortunately, women's voices are shut down, and they are forced, to just be quiet and not ask for anything. And that is where the role of male engagement comes in. If we have male partners in this journey, then it will be easier for them, if I may say in Swahili, kufanya utetezi wa wanawake pia, so that it's not a feminist war, men versus men, you know, sorry, men versus women, whether in terms of, is this right, is this not right, you know. And I believe, as Dr. said, when we are able to ensure that women have their bodily autonomy rights as well as sexual and reproductive health rights, it actually chips in to the improvement of our economy. And it actually empowers women and girls to be positive members of the community who also, you know, chip in economically. What my call to action would be, for government. Our government, you know, made a commitment during ICPD to ensure that the sexual and reproductive health rights of women and girls and young people are achieved, as well as their bodily autonomy rights. So as a government, ensure that, you know, you live up to the commitments that you made in the international platform, bring it down, you know, to now our local concept, and ensure that you implement this, and also the existing policies and laws, and the ones that people don't know, disseminate this information so that people are empowered to demand for their rights. If you don't know that this is your right, then you won't be empowered to demand for it. So cascade the information there. Yes.
Yeah. Thank you. I love your call to action that we need to cascade that information. And also, I just want to emphasize what you have said, that we are not in a gender war. Yeah. We are not in a gender war, and the empowerment, you know, empowerment is not a cake. It doesn't mean that if one group accesses the empowerment, that the other is not going to access it. So thank you for stating that. Over to you, Hadassah. What anchors you in your journey as an advocate for gender equality, and why is bodily autonomy such an important right that we need to elevate?
What anchors me is my passion for girl power. So I believe that when every girl is empowered, they're able to make a maximum opportunity to secure their future and put more effort on their rights. And also, your last question was? Why is bodily autonomy something that is so critical that we need to continue championing for? I think it will create more opportunities for girls to work on their mission to be empowered and empower other girls who have no information or access to education.
Yeah. And thank you for, again, I think you're complementing each other as you're speaking on the importance of access to information. Last but not least, to you, Dr.
So in terms of what anchors me, I believe that in this African continent, you know, we're working towards development. We're working towards making Africa that space that we believe in, that, you know, we're dealing with the historical injustices that we're coming from. But, you know, we cannot achieve that in a world where half of the population is disenfranchised. So I am so passionate about promoting women's rights, all women's rights, as I stated earlier. Bodily autonomy is one of them. It's a pivotal one. And all these rights are interrelated, they're interdependent. You cannot divorce them. They go hand in hand. So if we are working towards the development of this continent, we must really push for all the rights of women and girls, and bodily autonomy is one of them. So the passion I have as an African woman, and I am so proud to be an African woman, that is what drives me. And I believe African women, we have it. We can push this and we can work with African men, because as you say, it's not a contest. it's not a contest. There's a space for male engagement, and it's so, so critical. So how do we get Africa to being that continent, you know, putting Africa on the map? By promoting all these rights and by all of us being engaged. So in terms of my call to action, I will say let's all work towards creating safe and just spaces for women, for girls, for men, and for boys. You know, Wangari Maathai said, you empower a woman, you empower a village. And remember, that woman, she is somebody's wife, she is somebody's daughter, she is somebody's sister. So there are all these men in the village who will benefit from that type of empowerment.
Yeah. Thank you all of you for joining us in this conversation and for highlighting just the importance and how critical bodily autonomy is. I'd just like to close with the statement that Dr. has said. Let's work to ensure that we create safe and just spaces for all women and girls to exercise their rights. Thank you very much, and we look forward to seeing you in our next conversation.